I'm Elizabeth Green, and this is my presentation on balancing care and self-care. For the objectives, we're going to be assessing my current self-care, examining the benefits of self-care, developing a self-care plan, creating a SMART goal, and then recalling self-care knowledge. My current self-care consists of weaving, singing, and reading. This is something that I have weaved. I also, to reduce stress, I use breathing techniques, walking, and mindfulness. Things that get in the way of my self-care are feeling too stressed to get anything done. Stress can sometimes be paralyzing. Time, sometimes it feels as though I don't have enough time to even get self-care done, let alone school assignments. Class can sometimes get in the way of doing self-care, depending on when I need to be in class or what assignments need to be done. And proactivity. Sometimes if I want to get these things done and I have class and stress, I need to be proactive. When I have time, that's when I should be prioritizing my self-care. For literature on self-care, we can look to Self-Care for Nurses and Midwives, findings from a scoping review. First, you have compassion fatigue, which is the inability to exercise compassion. Because we deal with so many traumatizing cases, it sometimes can get hard to be compassionate to everyone. And we can't be everything that we're expected to be. And when we are fatigued, we don't provide the same level of care that we provide to other patients. Nurses need permission to perform self-care. During this case study, they were able to see that many nurses believed that unless their environments or their facilities allowed them that time to care for themselves, then they wouldn't be getting it done, and they felt like they needed permission. Self-care decreases burnout and secondary trauma. By prioritizing self-care, we are able to decrease our levels of stress, and so we're able to better prioritize the patients that we're caring for. And when we decrease our level of burnout, we're able to provide our compassionate care for longer. And by secondary trauma that we experience by being with patients that have been in traumatic experiences, we're able to care for more of those traumatic patients and be able to compartmentalize those emotions better. Strategies of self-care. According to Self-Care in Nursing, ways to prioritize self-care and care for ourselves is to work less than 40 hours per week and work consistency. Have a schedule that you follow and that you're not just taking random days and schedules. Express your emotions, exercise, and join a group. By expressing these emotions, you're allowing yourself to come to terms with them and eliminate them so you're able to better care for your patients. By joining a group, you can find others that also feel similar things to you and that you're not alone. Facilities can have decompression rooms, which are places where nurses and staff can de-stress from what they've done during the day. And you can eat healthy, get enough sleep, and use techniques like cognitive behavioral therapy to eliminate some of that extra stress. You can also use mindfulness, having more awareness of where you are and your body's place in the world. My self-care plan consists of making agendas. So I want to meal plan. If I have one day that I decide what I'll eat and what day that'll be, then I'll be able to eat healthier, having an idea instead of just grabbing whatever's quickest. I can also think of ways of when I'll fall asleep, what times I'll wake up, so that if I stick to a better schedule, my sleep will be more effective. I also want to look at our activities, like what days maybe I'll exercise and what those exercises will consist of. Also, different types of walks. One thing that I want to implement is daily 5-minute mindfulness. I have used it in the past, but it's been a while, and I think that taking a minute to breathe would really help me in my future nursing pursuits. I think daily positive affirmations would also be helpful. Just telling myself that what I'm doing is good and that my place in the world, that I'm helping others. And lastly, use a family support system. So I'll look to my family for their support. And like my sister, she's an OT. So she could be someone that too might need some of that decompression and could benefit from my self-care. For SMART goals, I was thinking in the terms of 3 weeks, just so I can dip my foot into it. I would want to identify sustainable self-care practices. This plan is great, but unless I'm able to actually perform it, then it's not effective. So I want to see what activities can I continue doing in the long term. I want to find someone to do this with. I mentioned my sister, and if you have someone keeping you accountable, then that can make your goals so much more effective. I want to make a planner. So I want to figure out what are those sustainable goals, and I want to add that to a planner that I can just go through and just at a glance know exactly what I'll be doing on what day to care for myself. And when's the best time? Some things like mindfulness are really beneficial, but if I don't have time in the morning and I try to skip it, then that's not effective. So finding the best time in the day that I should do these activities will help me complete them. In summary, my self-care will consist of creating schedules, planning ahead, prioritizing mindfulness daily, using professionals to decode my feelings, and aiding others in their self-care. And then here are my resources.